Hello, I'm Dr. Sanjay Panicker. Getting recurrent colds, many patients do ask me that is it because I have a cold issue, frequent cold issue, or is it an allergic issue? Now, how do you differentiate this? You can identify this either with certain blood test where you will know that there are certain allergens which you are sensitive to, and whenever you are exposed to that particular allergen, you are developing the sneezing. Like for instance, you go to a garden and then you start sneezing. Maybe there are certain pollens in that atmosphere which is making you to sneeze. Every time you switch on the AC of the car, maybe you start sneezing. So maybe it's the allergens in that particular AC. Generally, there are certain organisms which are present which you may be allergic to, and then you start sneezing. Or it could be, let us say, if you do your blood test, you find your IgE is elevated, immunoglobulin E, or your AEC is elevated, then probably you have allergic issues. And you can identify specific allergens with some specific test through a skin prick sensitivity test. You can know what you are sensitive to or what you are allergic to. Usually allergies can be seasonal or it can be throughout the year. Whereas infections, when it is a common cold, it is due to an infection. And an infection can be a bacteria, it can be a virus. And usually it happens in the cooler weather. When the weather is cold, people develop cold. And that is only when the weather gets cold, or it can be a change of temperature, like you are sweating and suddenly you get exposed to you sit under the AC for some time, or you take a shower and when you are sweating and then the sweat is suppressed and then your body suddenly chills and then you may catch a cold. So this can happen, and that may be due to an infection which you become prone to, or it could be a sensitivity to that particular climate. Let's say you move from Bangalore to Ooty, and due to that sudden change in the weather, you may develop a cold. When you identify the cause of it, if it is particular seasons, then it could be a seasonal allergy. Like for example, most of the allergic cases increase in rainy and winter. The reason is there are certain allergens in the atmosphere in that particular season. It could also be throughout the year. If there is an allergen inside your house or in the surroundings that you are living all through the year, you may have a perennial allergy. But cold is not like that. It is basically due to some trigger which lasts, maybe it may be slow in its onset and it may be there for 7 to 10 days and it comes up and you may develop sneezing, running nose. Maybe there is a fever. So in allergies, you have running nose, itching of the eyes and irritation in the eyes. You may have a feeling as if some kind of a ticklish sensation in the nose. You start sneezing, you may have body ache, but not necessarily fever. And it is always very sudden in onset. Like many patients tell me, I'm from Rajasthan, but the minute I landed in Bangalore, I had a problem. When I went back to my native, I did not have any issues. I have patients who tell me that I went to such a cool place like Switzerland and I still did not have the sneezing allergies. But the minute I landed to Bangalore and I have the sneezing. So that is the kind of sensitivity to that particular allergen that the patient has. It is sudden in its onset and they start sneezing continuously as soon as they are exposed to that allergen. It is not the temperature. So many people ask me, why do I have the problem only in Bangalore? Why I don't have it when I go to cooler places? So it is not because of the temperature. This is an allergic issue, and Bangalore is known for allergies, and it is said by certain people as the capital of allergies. So we often have patients coming up with allergic sneezing, allergic cold, allergic cough in Bangalore. Even skin problems, allergic skin issues are very common in Bangalore. All these allergies can be classified in one common name called as atopy. Atopy means a tendency to develop allergy, an internal tendency where the immune system is recognizing something else as a bacteria. Usually the immune system should be able to identify this is bacteria, this is virus, this is your own body, this is allergen. Somewhere it is identifying something else as a bacteria. Maybe it is dust particle, maybe pollen, maybe something else. and it is releasing histamine. The minute histamine is released in your nose, it causes running nose, sneezing, nose block, and all these symptoms. Whereas in cold, it is not just the histamine which is released due to some sensitivity to some dust particle or pollen, but there is an organism which it wants to kill, and so it releases histamine. And the organism also causes its own symptoms. So that is how you can differentiate between cold and allergies. Cold usually responds to antibiotics or some medicine specific to based on the infection that you have, or allergies usually responds to antihistamine and in severe cases corticosteroids. So that is how the treatment also is done. Hypersensitivity to cold. I have had patients who tell me that every time I take an ice cream, I catch a cold. Every time I drink water from the fridge, I develop cold. What is the reason for this? Now, it is a hypersensitive response of your body. Your immune system is identifying that temperature, that ice cold temperature, as a bacteria or as an unwanted thing, and it is releasing histamine even when it is not needed. It is a kind of a hypersensitive reaction, which is otherwise called as an allergy. Now, this is a presentation in patients with allergy, that they often have running nose, sneezing when they are exposed to cold, like they take cold things or cool drinks or ice cream. This can only be improved if you build up your immune system. And immune system production is controlled in the gut. So your diet plays a role in this. Also, homeopathic medicines which will improve the entire absorption of the nutrients, building up of the immune system. If it can be developed with the help of the right homeopathic remedy, then you can come out of these kind of allergies or hypersensitivity. This is possible by your homeopathic doctor, who can assess your body nature, personality type, stress levels, and understand how it is connected with your immune system development, understand a little about your lifestyle, and then make changes in this. And once that is done, then your immune system will respond and you will be able to take cooler things. Like I have children who are not able to take ice cream at all, and then after the homeopathic treatment for 1 or 2 years, the entire immune system is built up and works better than what it was earlier. So I have children who were not taking ice cream in the first year of the treatment, and the second year they're able to take ice cream. So that's how we can change the entire body's adaptability to the temperature. Seasonal allergies happening in particular season is because of a hypersensitive immune system. Repeated cold is because the immune system is not able to identify particular organism which is causing that particular infection, which is responsible for the cold. This both are in a way connected with the immune system development. Your immune system is not able to identify bacteria and viruses. What we need to do to improve this condition is we have to improve your immune system's ability to recognize that this is just a temperature change. This is just a seasonal pollen or dust particle or something in the atmosphere, and it need not react to it, need not think that that is a bacteria and respond to it that way. And it should be able to identify bacteria and viruses and attack and destroy it in a short span without causing too much distress. That oversensitiveness of the body and responding every time there is an infection around and not able to tackle it without causing a cold is what we need to improve. The immune system's ability or the memory to recognize that this is bacteria, this is virus, this is dust particle, and how it should respond to that. This is an intelligence of the body which is there inside you. Somewhere it is lost, and that's what we have to rebuild. That is possible with homeopathic constitutional treatment, which a homeopathic doctor will be able to help you. The most common remedies that are used for cold, cough, and sinus related issues are aconite, belladonna, bryonia, ipecac, calibicromicum, argentum nitricum, sabadilla, dulcamara, natramur, sulfur, pulsatilla, eparsulf, and many other remedies. Now, how do you differentiate between these remedies is what a homeopathic doctor is required for. A common man may not be able to identify which condition, which remedy to give, because it is purely individual symptom-based treatment that is there in homeopathy. Common cold has 3000 different medicines. I have only cited a few of them. but there are so many medicines which can be used for common cold. Now, how do we differentiate is based on the symptomatology of the patient and the observations of the physician. Based on all this, we prescribe medicines for cold, cough, and if the identification and the prescription is right, then common cold is resolved in 2 to 3 days. So it is as good as your antibiotic, which also takes about 2 to 3 days. And so in about 3 days or 5 days, the antibiotic clears the situation. The same way, here what happens is your immune system develops, kills the organism and clears the infection. And that's how we can sort out common cold or any kind of infectious cold of the patient.